Have you ever walked away from the bathroom only to feel like your bladder still isn't completely empty? Maybe a few drops leak into your underwear moments later, or you find yourself needing another trip to the toilet much sooner than expected. If that sounds familiar, you're definitely not alone, and more importantly, it isn't something you should simply ignore. Failing to empty your bladder properly can leave urine trapped inside, increasing the likelihood of urine dribbling, frequent bathroom visits, bladder irritation, infections, and in some cases, even kidney stone formation. The good news is that there are a few simple techniques that can make a real difference. In this video, I'm going to share 3 practical strategies that can help you empty your bladder more effectively every single time you urinate. These tips are especially helpful if you've been feeling frustrated with lingering urine or constant dribbling, and I can almost guarantee that the final technique is something you've probably never tried before. Stay with me until the end, because each step builds on the one before it, and together they create a simple routine that may completely change your bathroom habits. Now, before you assume I'm joking, my very first recommendation is actually to sit down and relax. Yes, I mean exactly that. I know many men immediately think, men stand when they pee. That's understandable, and if you're out in public using a urinal, standing is perfectly reasonable. But when you're at home, where comfort and privacy aren't an issue, I want you to give sitting down an honest try. There is a very important reason for this. Most men are constantly in a hurry. We rush into the bathroom, try to finish as quickly as possible, and often push hard in an effort to strengthen the stream and empty every last drop. Unfortunately, that approach usually works against us instead of helping. When you strain aggressively, the pressure inside your abdomen rises significantly. That extra pressure can actually trap urine within the urethra rather than allowing it to leave naturally. Then, as soon as you stand up and start walking away, those remaining drops finally escape, leaving you with that familiar dribble inside your underwear. If you've experienced that before, it's a strong sign your bladder wasn't truly empty in the first place. Instead, I want you to slow everything down, sit comfortably on the toilet, and lean your upper body slightly forward, resting your elbows gently on your knees. Take several slow, deep breaths. Allow your stomach and pelvic area to relax instead of tightening them. As your body releases unnecessary tension, let your urine flow naturally without forcing it. Avoid rushing the process. Give your bladder enough time to empty on its own rather than trying to squeeze every drop out through effort alone. Ask yourself this: is spending another 30 seconds in the bathroom really more inconvenient than making several extra trips throughout the day or dealing with embarrassing urine leakage afterward? For most people, the answer is obvious. A little extra patience now can save you a lot of frustration later. If this is your first time here, welcome. My name is Eric, and I'm a doctor of physiotherapy with a special focus on men's pelvic health. Every day I work with men dealing with challenges like urine leakage, bladder emptying problems, erectile dysfunction, pelvic floor weakness, and many of the issues that become more common as we get older. My goal is always to provide practical, evidence-informed strategies that you can actually use in everyday life. Before I explain the next 2 bladder emptying techniques, I want to introduce something I like to call the gentleman's agreement. If you've watched more than one of my videos and you found the information helpful, then I have one small favor to ask. Subscribe to the channel. That's your way of supporting the work that goes into creating these educational videos, and it doesn't cost you anything. Think of it like contributing to something valuable and receiving useful knowledge in return. By subscribing, you're also letting me know that this type of content is helping you, and it encourages me to continue creating videos that answer the questions men are often too embarrassed to ask. While you're at it, leave a comment below and tell me what health topic you'd like me to cover next. I read those comments carefully, and many future videos are inspired directly by your suggestions. Thank you for being part of this community, and now let's move on to the next technique that can help you empty your bladder much more completely. Now that you've decided to keep an open mind and give sitting down a real chance, let's build on that first step with a technique that is surprisingly simple but incredibly effective. Most men assume that once the urine stream stops, the bladder has finished emptying. In reality, that's often not the case. Even though it feels like you're done, a small amount of urine can still remain inside the bladder or within the urethra. That leftover urine is often the reason you experience dribbling just seconds after leaving the bathroom or find yourself needing another trip far sooner than you expected. Fortunately, there is an easy solution, and it's called double voiding. This technique has been used for years to help people empty their bladder more completely, and once you understand how it works, you'll realize why it can be such a powerful habit to develop. Here's exactly what I want you to do. After you've been sitting comfortably and you believe you've completely finished urinating, don't rush to zip up your pants and leave. Instead, slowly stand up from the toilet. Once you're standing, remain there for about 4 seconds. During those few seconds, take one slow, deep breath in through your nose and gently breathe out through your mouth. Don't strain, don't rush, and don't immediately start walking away. After those 4 seconds have passed, simply sit back down on the toilet and try to urinate again. You may be surprised by what happens next. Even though you thought your bladder was empty only moments ago, many men are able to pass another noticeable amount of urine. That second release is exactly why this method works so well. It gives your bladder another opportunity to empty the urine that was still left behind. To understand why this happens, it's helpful to know a little about how your pelvic floor works. After most men finish urinating, there's a natural habit of giving the penis a quick shake before pulling up their clothing. While that seems harmless, the movement can sometimes cause the pelvic floor muscles to tighten slightly. These muscles sit deep inside the pelvis and wrap around the urethra, which is the tube responsible for carrying urine out of the body. When those muscles tighten too early, they can partially close off that passage before every last drop has had a chance to escape. Imagine bending a garden hose while water is still flowing through it. The flow slows down or even stops because the hose has become pinched. The moment you release that bend, water begins flowing again. Your urinary system can behave in a very similar way. If the muscles around the urethra tighten too soon, a small amount of urine remains trapped. As soon as those muscles relax again while you're walking or changing position, those leftover drops begin to leak out, often ending up in your underwear instead of the toilet. There's another important reason this matters. Inside your urethra are tiny sensory receptors that constantly communicate with your brain. When even a small amount of urine remains, those sensors continue sending signals that your bladder hasn't completely finished emptying. Your brain interprets those messages as another urge to urinate, even though you were just in the bathroom a few minutes earlier. That's one reason some men feel like they're constantly making trips to the toilet throughout the day. It's not always because the bladder is filling unusually fast. Sometimes it's simply because the previous bathroom visit never fully emptied the bladder in the first place. By standing briefly, allowing your muscles to reset, taking a slow, calming breath, and then sitting back down for a second attempt, you give your urinary system another chance to finish the job properly. Now here's where things become even more interesting. The double void technique alone can make a noticeable improvement for many men, but I have one more strategy that takes this process to another level. In fact, this final technique is often the one that surprises people the most because it seems almost too simple to make a difference. Yet, once you understand the mechanics behind it and actually try it yourself, you'll quickly see why so many men notice a significant improvement. If you've ever walked away from the bathroom thinking you were finished only to experience dribbling moments later, the next step may be exactly what your bladder has been missing. So stay with me, because the third technique is where everything comes together. Now let's move on to the third and final technique, because this is the step that many men have never heard of before. It may look a little unusual at first, but don't let that stop you from trying it. Sometimes the simplest movements can have the biggest impact on how well your bladder empties. Once you've completed the double void technique, by standing for a few seconds, taking a slow breath, and sitting back down again, don't try to urinate immediately. Instead, I want you to prepare your body for one final step that helps release any urine still hiding inside the bladder or urethra. Here's exactly what to do. Sit comfortably on the toilet with both feet flat on the floor, about shoulder width apart. Keep your posture relaxed rather than stiff, and place both hands gently on your stomach. Now slowly lean your upper body forward, then gently rock back until your lower back lightly touches the back of the toilet seat. That's 1 repetition. Repeat that same smooth movement 4 times. As you move, don't hold your breath. Continue breathing naturally and keep your shoulders relaxed. There's no need to rush or use force. The movement should feel slow, controlled, and comfortable from beginning to end. By the time you reach the 4th repetition, something important has happened inside your body. This gentle rocking motion changes the pressure within your abdomen in a natural way while encouraging your pelvic floor muscles to relax instead of tightening. Think of it like preparing a manual water pump before the water begins flowing. You're not forcing anything. You're simply helping your body create the right conditions for the remaining urine to move more freely. Many men are genuinely surprised by how much additional urine comes out after performing this simple movement. Even though they believed their bladder was completely empty only moments earlier, they often discover there was still more urine left behind. That's exactly why this technique can be so effective. The science behind it is actually quite straightforward. Small changes in body position influence the relationship between your bladder, pelvic floor, and abdominal muscles. When everything stays relaxed, urine has a much easier path out of the body. On the other hand, if those muscles stay tight or you continue straining, small pockets of urine can remain trapped near the bladder outlet or inside the urethra. The gentle rocking motion helps remove some of that unnecessary tension while also shifting pressure in a way that supports more complete bladder emptying. Instead of relying on force, you're working with your body's natural mechanics, which is always the better approach. I know some of you may be thinking that rocking back and forth on the toilet sounds a little strange, but remember, you're in your own bathroom where nobody is watching. There's absolutely no reason to feel embarrassed about using a technique that may improve your bladder health and reduce urine leakage. If a movement that takes less than a minute helps you avoid wet underwear, repeated bathroom visits, or the constant feeling that your bladder never fully empties, it's certainly worth giving an honest try. Sometimes the habits that seem unusual at first become the ones that make the biggest difference over time. Once you've completed the 4th gentle rock, pause for a moment. Take another slow, deep breath in, then breathe out completely. As your body relaxes, try urinating one final time without pushing or straining. Be patient and allow any remaining urine to leave naturally. Don't rush the process just because the stream is lighter than before. Even a small amount of leftover urine is worth clearing if it means you'll feel more comfortable afterward. When nothing else comes out and you truly feel empty, you can stand up with confidence, zip up your pants, flush the toilet, wash your hands, and continue with your day knowing you've given your bladder the best opportunity to empty completely. For many men, combining these 3 simple techniques, sitting down, double voiding, and the gentle rocking movement, can dramatically reduce post-urination dribbling and improve overall bladder emptying without medication or complicated treatments. Now that you've learned the complete 3-step bladder emptying routine, let's talk about a few additional habits that can make those techniques work even better. The way you hydrate throughout the day has a direct effect on how your bladder behaves, and many men accidentally make their symptoms worse without realizing it. One of the most common mistakes is simply drinking far more fluid than the body actually needs. Staying hydrated is important, but there is a balance. My general recommendation is to drink enough water so that you stay properly hydrated without constantly flooding your bladder. If you're taking in excessive amounts of fluid from morning until night, your kidneys naturally produce more urine, which means your bladder has to work much harder. That increased workload often leads to more frequent trips to the bathroom and can make symptoms like urgency, leakage, or incomplete emptying feel even more frustrating. Instead of forcing yourself to drink large amounts because you think it's healthier, aim for a level of hydration that keeps your body functioning well without overwhelming your urinary system. It's also worth paying close attention to what you're drinking, not just how much. Certain beverages naturally stimulate the bladder and increase urine production. Coffee is one of the biggest examples because caffeine has a diuretic effect. The same is true for many soft drinks, energy drinks, and caffeinated teas. While enjoying these occasionally isn't necessarily a problem for everyone, consuming them throughout the day can cause your bladder to fill more quickly and may increase urgency, frequency, and nighttime bathroom visits. If you're already struggling with bladder control or post-urination dribbling, reducing these drinks for a few weeks is a simple experiment that's well worth trying. Many men notice a meaningful improvement just by making a few adjustments to the beverages they consume every day. Now let me share another tip that many people rarely hear about, yet it can make a surprising difference, especially if you're waking up several times during the night to urinate. Take a close look at what happens after dinner. For many people, the evening doesn't end with the last meal. It includes dessert, cookies, chips, ice cream, chocolate, or another late-night snack while watching television. Although it may seem harmless, eating sugary foods late in the evening can influence how much urine your body produces overnight. Sugar interacts with water in your body, and that process can encourage your kidneys to produce additional urine while you're trying to sleep. As a result, your bladder fills more quickly during the night, making it much more likely that you'll wake up once, twice, or even several times needing to use the bathroom. If you've been wondering why your sleep keeps getting interrupted, your evening eating habits could be playing a bigger role than you realize. A practical solution is to reduce or completely avoid sugary snacks after dinner whenever possible. If you truly feel hungry later in the evening, choose an option that contains very little added sugar, or simply finish your final meal earlier and avoid unnecessary snacking altogether. Then pay attention to how your body responds over the next several nights. Many men notice that they're able to sleep longer before needing to urinate, and some even find that they wake up fewer times than they did before. These changes may seem small individually, but when combined with proper bladder emptying techniques and healthier daily habits, they can have a significant impact on your overall quality of life. One thing I always remind my patients is to be patient with the process. Bladder problems usually don't appear overnight, and they rarely disappear overnight either. Your urinary system develops habits over months or even years, which means lasting improvement also requires consistency and time. Don't become discouraged if everything isn't perfect after the first day or two. Continue practicing the 3-step routine every time you use the bathroom. Stay aware of your fluid intake, make smarter beverage choices, and be mindful of your evening eating habits. Small improvements repeated every single day often produce far greater results than dramatic changes that only last for a short time. Give your body the opportunity to adapt, and you'll be much more likely to experience steady, long-term progress instead of temporary improvements that quickly disappear. If you've been applying these strategies consistently, but you're still dealing with urine leakage, frequent bathroom trips, or the constant feeling that your bladder never completely empties, it's important to recognize that there may be a deeper issue contributing to your symptoms. While the techniques we've covered today are highly effective for many men, they aren't meant to replace a personalized assessment when problems continue. Some men develop pelvic floor dysfunction, others experience changes related to the prostate, and some simply need a rehabilitation plan that's designed around their specific symptoms, medical history, and lifestyle. That's why I always encourage men not to accept these issues as a normal part of getting older. There are often practical solutions available, but the first step is identifying exactly what's causing the problem. For men who need more individualized guidance, I offer one-on-one online coaching where we work together to understand what's happening and create a rehabilitation program tailored specifically to your needs. During our video consultations, we go far beyond general advice. We look at your symptoms, your daily habits, your movement patterns, your bladder routine, and any contributing factors that may be preventing long-term improvement. From there, we build a step-by-step recovery plan that you can confidently follow at home. The goal isn't simply to reduce symptoms for a few days. The goal is to improve the way your bladder and pelvic floor function so you can regain confidence in your daily life and stop planning every outing around the nearest bathroom. If you'd like to learn more about working with me, you'll find a link to my website in both the video description and the pinned comment below. I also offer a free introductory consultation so we can discuss your concerns, answer your questions, and determine whether personalized coaching is the right fit for you. There's no pressure and nothing to lose by having that conversation. While you're visiting the website, I also encourage you to spend a few minutes reading through the success stories and testimonials from men I've had the privilege of helping. Many of them started exactly where you are today, frustrated by constant urine leakage, embarrassed by post-urination dribbling, or exhausted from waking several times every night to use the bathroom. Through consistent rehabilitation and the right strategies, they've been able to regain control and improve their quality of life. And that's always my goal for every man I work with. One of the greatest advantages of online coaching is that location is no longer a barrier. Whether you live nearby or on the other side of the world, we can connect through secure video consultations and work together from the comfort of your own home. Men's pelvic health is my primary area of focus, and helping men overcome bladder problems, pelvic floor dysfunction, and related concerns is what I dedicate my professional life to every single day. If you're tired of living with urine leakage, constantly searching for the nearest restroom, or allowing bladder problems to control your schedule, don't keep hoping the issue will disappear on its own. Take action, seek professional guidance when needed, and give yourself the opportunity to improve. Remember, every positive change starts with one small step, and today's 3 simple techniques are an excellent place to begin. Thank you for spending your time with me today. I truly appreciate you being here, and I hope these strategies help you feel more confident every time you use the bathroom. Until next time, take care of yourself, stay consistent with your progress, and I'll see you in the next video.